Health research wouldn't exist without researchers. Health research wouldn't exist without labs. Health research wouldn't exist without funding. And health research wouldn't exist without patients. Patients who are much more than passive volunteers who try new treatments. They are active research partners, and their needs are at the center of open science. Not only their medical needs, but their need for accessible information to empower them in making informed decisions while contributing to the advancement of science. For many diseases, even the most brilliant scientists are still trying to find ways to defeat the enemy. Amyotrophic lateral sclerosis is one of those diseases. On the arduous path leading to a cure, the ALS Society of Canada advocates for the recognition of the patient's essential role in research while ensuring they receive the highest possible standard of care. Please welcome their CEO, Tammy Moore, who is here to share her thoughts with us.
Thank you to the organizing committee and the co-chairs, Dr. Guy Rouleau and Dr. Janet Rosson, for this opportunity to present on patients as partners in research and healthcare. I'm pleased to have this opportunity to share the experience within ALS Canada and how people with lived experience have informed our work and enriched our organization. I'll be sharing it through highlighting some of the people in our community who have informed, influenced, empowered, and inspired us along the way. Good afternoon, I am Tammy Moore, the CEO of the ALS Society of Canada. To provide context, I thought it would be helpful to provide an overview of the ALS Society of Canada and our mission. ALS Canada is a donor-funded charity with a dual role, provincially for the support of people affected by ALS in Ontario, and nationally for advocacy and research. In our provincial role, ALS Canada supports people affected by ALS within Ontario to help them to navigate their journey with the disease. Our regional managers are immediately there for the patient and their family from the moment of diagnosis, as a trusted support, providing information, connecting to resources, and facilitating peer review support groups. As we fill the gaps left by the healthcare system, we also provide accessibility equipment, such as hospital beds, lift chairs, ceiling lifts, and bathroom equipment, so that people have what they need to maintain their independence and stay in their homes safely. There are societies across the country who provide similar services within their provinces, as provincial healthcare has a great deal of variability across our country. The community-based support we provide keeps us connected to the people we serve and helps to inform our national mandates. ALS Canada advocates for the needs of the ALS community at both a provincial and a national level. Current national priorities include dedicated research funding and access to therapies, whether working with industry or at the federal level for approvals and reimbursement. Increasingly, advocacy is a growing area with new therapies coming to market and in the pipeline. This is also a very important area for the unique perspectives of people living with ALS to inform decisions. As a third component of our mission and national mandate, ALS Canada runs a comprehensive research program. We have a role as a facilitator and convener with the clinical and research community across the country, bringing together with clinicians and researchers so that they can foster collaboration and knowledge exchange. Through our grant competitions, we make critical investments to increase ALS research capacity and fund projects which aim to fulfill our mission for a future without ALS. Not only is the community the people we serve, they are also an important role to inform our programs and participate in decision-making. This full circle has had an incredible impact on our organization. I am pleased to be here today to speak at the Nero Gardner Open Science Symposium, as the concept of open science aligns with patients as partners in research and healthcare. In a similar way that open science makes the research process and outcomes more transparent and accessible, true partnership with patients means there is visibility into the process and decision-making. People with lived experience are actively engaged and contributing, whether it be in the course of an organization's governance or specific project. By engaging in open science and involving people with ALS as partners, the process benefits from the input of diverse experiences, perspectives, and the opportunity to learn and evolve along the way. I know this is an important principle in the work undertaken here at the Neuro. When initially looking at this slide, it would be easy to think of this engagement as pushing out to the patient community. Instead, I challenge it as a two-way flow, which yields richer, more meaningful results. Patients have an important role to play in informing, influencing, and empowering the organization and our work through their lived experience. They have a passion for giving back, for making a positive change for themselves and others. At times, they see it as their legacy as they try to make sense of their diagnosis. I also want to acknowledge that by no means are we at an end state as an organization. We are committed to continue to evolve, to go further in the engagement of patients as partners, and we continue to look to others to influence them as well. Representing 46 groups and millions of Canadians living with disease, the Health Charities Coalition of Canada and Best Medicines Coalition undertook a project to assess and address patient engagement. Of the considerable number of recommendations, 2 specific areas of guidance are noted. Patient representatives should be involved early in the design of the engagement process and development of the terms of reference. There should be an opportunity to contribute from the outset of a project and throughout the process. And secondly, what patients bring to the table in the engagement process should be considered as expert knowledge and on par with that of the medical, government, or institutional professionals, and they should be compensated accordingly for their expertise. From best practice, it is recognized that involvement throughout the governance structure will yield a better result, benefiting from the input of many people in the diversity of perspectives. This guidance was actioned as we embarked on our own strategic planning exercise at ALS Canada. Along with multiple stakeholder groups, people with lived experience inform the process through interviews, workshops, feedback, and they help set the direction for our organization for the future. Within our own governance structure, at every level, people with lived experience are at the table and contribute to the decisions. In the formal structure of governance, at our board of directors, our client services advisory council, our scientific medical advisory council, our peer review process, our advocacy committee, on specific projects and initiatives, and informally throughout their council. People with lived experience are at the center of everything that we do. During our strategic planning exercise, we were informed by our community. At a stakeholder event, we engaged a panel of people living with ALS to understand what it was we should be contemplating as we look to a future of longevity with ALS. Dr. Sutherland and his wife and caregiver, Darlene, shared their experience of living with ALS for 12 years. Beth Robertson shared her experience that she had shared with her husband of 14 years. And they were joined by Eddie Lafrancois, who had lived 25 years with ALS. At the very outset of the planning, Eddie helped to inform the process for the engagement, what it could be, how it could look, and what we would hope to gain. As a snapshot from that event, we learned about Eddie's experience of living in a small rural village in Northern Ontario and the realities of having to travel to visit a multidisciplinary clinic to have his annual visit, to adjust his wheelchair or get a communication device. Driving with a caregiver for 3 hours from Dubreuilville to Sault Ste. Marie, to catch a plane, to fly to Toronto, to catch a connector back to Ottawa. The challenges of flying with a power wheelchair and in small planes, the lack of connectivity in the community. He talked about the isolation and the need for healthcare to wrap around his specific needs, to be more practical and understanding of a rural experience. The richness of this learning informed and substantially shaped our strategic impacts and gave very different considerations to our future program development. To build on this individual input and broaden the experience, we have been working through developing a better understanding of the patient journey prior to diagnosis through to the end of life. We've been seeking to understand and articulate the pathways that different people take as they navigate their disease, within the healthcare system through community supports, access to information, and the healthcare system interactions along the course. During this project, we involved people with lived experience at the outset to work on the project design, to inform the process, and to validate the outcomes. The resulting composite personas reflect the broad experiences of many individuals to add depth to our understanding of the patient journey. We use this patient journey to understand the points of intersection, gaps and opportunities, and we utilize the personas as lenses to understand and evaluate our program development. We are greatly appreciative of the significant contributions of our community to design, inform, and support our work, resulting in greater tools for our organization than we've been able to share more broadly with other ALS organizations to inform their work as well. Often we hear concern from researchers that people actively living with ALS may only focus on near-term solutions and immediate clinical trials. And yes, for some people, this is their priority. It makes sense. ALS is an urgent disease. Each day that passes is measured in loss of function and loss of life. But for other people, they want to explore the legacy of their contributions and the need to make investments that will lead to greater understanding. Mcauley was one of these people who focused on a longer-term strategy in the need to understand ALS. Through his desire to leave a legacy for the future, Chris influenced Canada's involvement in Project MIND, an international open science initiative to share over 22,000 whole genome sequences. As a global resource, Project MIND will make ALS easier to study and has great potential to lead into effective treatments. Chris influenced contributions to Project MIND in Canada to help make things better for people who will be diagnosed with ALS in the future. To quote Chris, "I think of others who will come after me and, like me, lose the blossom of their health so insidiously. I want to do something to make it better." Chris would be very proud that Project MIND has now led us to an even more robust project as we look to understand ALS. Capture ALS will build on the whole genome sequences of Project MIND and take this so much further. At its foundation, Capture ALS is the perfect marriage of patients as partners in research and open science. It strives to provide an opportunity for all Canadians with ALS to make a unique contribution to the understanding of ALS in a national open science platform. By individual patients contributing their samples, we will gain a deeper understanding of their specific disease and ALS overall. This will be a critical tool for Canadian researchers and will plug into other international projects. As we think about research, particularly clinical trial design, patients are offering the most generous contribution in the process and taking the greatest personal risk. The paternalistic sentiment that used to prevail has started to change. It is less likely you will hear patients referred to as subjects, and as the language changes, itself is an indicator of a more human-centric approach. We know that involving patients at the early stages of clinical trial design can reduce dropout rates. Through understanding and consideration as to outcome measures that are important to patients and identifying physical, emotional, and financial needs of the patients at the outset, appropriate solutions can be built into the program to ensure the greatest likelihood of completion. These are people who may not even benefit from the trial, but are altruistically offering of themselves as a legacy for others. They have an important role to play beyond the trial participation itself. When patients are engaged throughout the governance of an organization and program development, their contribution is part of the conversation from the beginning, and they are part of the decision-making. It can be more difficult to discern their own specific voice. Rest assured, their contributions will influence the outcomes. Melanie York was a member of the Board of Directors of ALS Canada and our Scientific Medical Advisory Council. She challenged the conversation and actively participated in decision-making. Melanie brought her experience as a vibrant and passionate communicator, her professional expertise for strategy, and her personal experience of actively living with ALS. There are specific areas where we continue to see Melanie's influence, including the prioritization of the clinical management grant within our grant competitions. Melanie challenged our Scientific Medical Advisory Council to see beyond the disease and see the person in their current reality. Her influence and contribution continue to be felt in our organization today, 5 years after her death, as we challenge ourselves to do better. When people are well supported to bring the richness of their lived experience and their passion to make a difference, their contributions can be even more powerful. At the most basic level, addressing their physical needs and potential barriers to contribute is just the beginning, but often overlooked. Sometimes it's as simple as consideration of the accessibility of the location for someone in a wheelchair, the timing of a meeting to allow for caregiving support in the morning, or the opportunity to participate with a communication device, or sometimes financial compensation for their participation. Interestingly, the COVID crisis and the move to a virtual environment is reducing the barriers for inclusion. Training programs can be an important support for patients to bring their lived experience to more technical areas, to reduce the intimidation and appropriately equip them to contribute. Within research, we are learning from the patient program at the Northeast ALS Consortium, or NEALS, for the Clinical Research Learning Institute, also known as the CURLIs. The mandate of this program is to empower patients to be advocates, to be able to influence and improve research process. As we develop a Canadian program, we look forward to assist people with lived experience in contributing at our Scientific Medical Advisory Council and supporting them to move from observer to active participant in our international peer review panel. Patients want to advocate for issues that touch their lives. The drug approval and reimbursement pathway in Canada is a particularly challenging area that is shrouded behind multiple agencies and jurisdictions. While the simple response is fix it to meet our needs, equipping patient advocates with background information and helping them to understand the intricacies can make them even more powerful advocates as they underscore the very real human impact of the technical issues. Early in March, the week that the COVID crisis hit, we brought together patients, caregivers, researchers, and clinicians, volunteers, and staff to inform them about the technical issues of the drug approval and reimbursement pathway before sending teams out to meet with parliamentarians and senators to discuss the issues. Repeatedly, we have witnessed the power of sharing the personal impact of policies and programs that work or don't work for our community. In the alignment between the patient voice and the issue is empowerment for both the person and the organization. Brian Parsons was instrumental in the development of our advocacy program at ALS Canada. We learned from his experience as a staffer on Parliament Hill and were empowered as an organization, knowing we were speaking on behalf of the ALS community. Through his passion to leave a legacy that would make a difference for future Canadians and his relentless drive, he influenced the change to the compassionate care benefit in Canada. Brian had a deep understanding of the technical issues, and he could counter any bureaucrat's argument. And then he could take the air out of the room with the emotion of his personal perspective. 1,000 Canadians have died since I was last here on the Hill. How many more will die before you make a difference? I won't be here next year. After witnessing the unfortunate diagnosis and rapid progression that Muriel Boulanger faced after being elected to the federal government in 2015, his colleague MP Francis Drouin agreed to chair the ALS caucus. People living with ALS are at the table of every caucus meeting, helping to bring forward the day-to-day realities of the issues that the caucus is looking to address. In 2017, members of the ALS caucus traveled across Canada to meet people living with ALS, other societies, clinicians, and researchers. As we visited the Neuro, it was an opportunity for Norm McIsaac to share his personal lived experience with ALS. Alongside Dr. Genge and researchers, we met with the labs throughout the Institute. The diversity of perspectives, but aligned focus, helped to inform the caucus members of the issues in clinical care and research funding across our country. This opportunity for direct engagement between the parliamentarians, senators, and the ALS community has been empowering for both parties. For the politicians to know the personal impact and understand they are representing constituents as they look forward to bring change, and for the community to know their issues are being heard. For the progress that has been made for patients as partners, there continue to be significant opportunities for improvement. In each of our organizations, we should ask ourselves, are there other areas within our structures that could benefit from the inclusion of people with lived experience? As programs and projects are developed, are patients included at the earliest stages to ensure they have input into the design and to create more spaces for meaningful engagement? Are people with lived experience treated on par with the experts and supported in their contribution? Are they part of the decision making? We continue to learn from our counterparts through Cystic Fibrosis Canada and their relationship with CF Get Loud, and look to the urgent passion of patient-led initiatives such as ALS Action Canada or IMALS. These are the organizations that help to break down walls. Where are the points of alignment and the opportunity for engagement for your organization? An area that stands out for the greatest opportunity for improvement is within the drug approval and reimbursement pathway. People with lived experience are not appropriately engaged. The unique realities of specific needs of disease is not considered, and patient contributions are minimized during the process. At ALS Canada, this is a significant area of focus for our advocacy program. As we look to make improvements within the Canadian Agency for Drug and Technology Health Assessment, or CADA, PMPRB, the Patent Medicines Prices Review Board, the Pan-Canadian Pharmaceutical Alliance, or even within the development of the Canadian drug agencies. Yes, these agencies fulfill a technical function, but their work should be informed and influenced by understanding the human impact of their work and what is meaningful to people living with disease. And as I close, once people with lived experience are engaged, be prepared to be inspired. At the annual ALS Canada Research Forum, each year, we create opportunities for connections between many stakeholder groups with a focus on people with lived experience and researchers. Each year, we hear from our research community how impactful it is to have this interaction with the community. As we open the forum with the Impact and Inspiration Dinner, this is Stephanie Christensen Hall, who shared her experience as a mother of 3 children as she's living with ALS. Even as she talked about the harsh reality of what it's like to contemplate the loss of ability to push her own child on a swing, she talked about the hope that the researchers gave to her through their work. That is a powerful motivator for any researcher to take in. Over dinner, community members and researchers connect on a personal level to understand each other's experiences and to learn about the areas of research currently underway. People with lived experience open the sessions at the forum to anchor the presentations in why we are all there and the work that we do. These connections both inform and inspire both parties. This actually isn't a quote from Stephanie, but instead from a researcher. For a young researcher in a lab, this may be the first time they have ever met a person living with ALS. It can be profound and a long-lasting motivation to have personally met the people who are living with the disease that a researcher is looking at through a microscope each day. To focus on patients as partners in research and healthcare is an important consideration for open science and a recognition of the contribution people with lived experience have to make. I hope this presentation has helped to convey the importance of this partnership and potential ways that you may extend it into your own work. Thank you to the Montreal Neurological Institute, Hospital, and Gardner Foundation for this opportunity.